Welcome! Today we're going to discuss using the Treatment Plan Financial Worksheet to present to a non-insured patient. As always, we recommend using two devices while learning. One to view these instructions, and the second one, your iPad with DDS-GP installed, to follow along in real time. Ready? Let's get started. This section explains how to use the Treatment Plan Financial Worksheet when presenting a case to a patient without dental insurance. The worksheet, found on the app's icon menu or sidebar, is designed to simplify financial discussions by providing a clear, concise overview of the treatment cost. Many practices prefer to complete the worksheet in advance and provide a printed copy for the patient to review and sign. A handwritten signature is often perceived as more personal and meaningful than a digital one, and providing the patient with a signed copy reinforces their understanding and commitment. The signed worksheet should then be scanned into the practice management software for documentation. To begin, enter the patient's name and a description of the treatment plan. This description should reflect the entire bundle of treatment rather than listing individual procedures, for example, upper right quadrant treatment, rather than crown on number 3. Next, enter the total case fee using your office's UCR, usual, customary, and reasonable fee schedule. This should represent your standard full fee. Then select None from the insurance status dropdown to indicate that the patient has no dental coverage. Once this is selected, additional relevant options will appear. Next, determine if the case qualifies for a prepayment discount. If the practice policy allows a discount for full prepayment on treatment plans above a certain amount, e.g. $2,000, this discount can be applied to the patient's balance. For example, a 5% discount on a $3,500 case would reduce the patient's balance by $175, bringing the total to $3,325. Offering this discount encourages immediate payment, which can improve accounts receivable and reduce cancellations by fostering a psychological commitment. In the event of a cancellation, any prepayment should be refunded, but offering such a discount typically decreases the likelihood of cancellations. As always, we encourage you to incorporate DDS-GP into all of your treatment plans, no matter how big or small. If you have any questions or comments, please visit our website at www.ddsgp.com